Hello guys, welcome back. Today I'll be taking class on jugular venous pressure, that is JVP, which is important practically and as well as for your theory purpose. So without wasting much of your time, I will start on jugular venous pressure. So here I have drawn the normal heart. This is your right atrium, this is your right ventricle, this is your left atrium, and this is right ventricle. You can see here the right atrium and right ventricle. Between right atrium and right ventricle there is tricuspid valve. This is your tricuspid valve. Okay, already I have mentioned. So this is your tricuspid valve, and between left atrium and left ventricle there is mitral valve. So and you can see here there are two large veins, that is your superior vena cava and inferior vena cava, that bring blood from peripheries to your right atrium. Okay, so this is the basic anatomy of heart. Okay, so now coming to the topic proper, jugular venous pressure. Now just remember there are 6 waves that we get in JVP. You have A wave, you have C wave and V wave, which are positive waves, and X and Y are negative waves. Okay, just remember that A, C, V are positive waves, X and Y are negative waves. So what does positive mean? Positive means that there is increase in right atrial pressure, and negative wave means there is reduction in right atrial pressure. So JVP is concentrating mainly upon your right atrial pressure. Just repeat friends, JVP is measuring right atrial pressure. Okay, keep this in mind. So let's go to the next diagram. So what I have drawn here, so this is from starting process. You have right atrium, you can see right atrium here. The blood has come from periphery to your right atrium. Okay, blood has come all the way from periphery to your right atrium. So blood is full now, and what is happening initially, that is in the late part of right atrial systole. Okay, keep this in mind what I am telling, concentrate. In the late part of right atrial systole, the blood is getting emptied into the right ventricle. You can see here I have marked here, the blood is getting emptied into the right ventricle. What happens in the late part of atrial systole, friends, is there is effective right atrial contraction. I have marked here, there is effective right atrial contraction. Due to this effective right atrial contraction, there is increase in pressure, increase in right atrial pressure. So what happens, friend, this pressure is transmitted to your internal jugular vein, producing the first positive wave, that is your A wave. Think you understood. So what happens after the A wave? You can see here the blood from the right atria is getting emptied into the right ventricle. Okay, and thus there was production of A wave. So after the blood has emptied from right atrium to your right ventricle, the tricuspid valve closes. Okay, you can see here tricuspid valve has closed, producing S1. Okay, S1 sound, that is first heart sound. So here you can see here here tricuspid valve has closed, and the atria, all the blood that was there in your right atrium was emptied into the right ventricle. So now there is no blood in the right atrium, so the right atria will relax. Right atrium is going to relax, which produces your X wave, that is your first negative wave. X wave is due to the atrial relaxation. So now the blood is in the right ventricle. Okay, the blood is in the right ventricle. Now this blood has to get emptied, obviously from the right ventricle. It has to get emptied. So what will happen? Initially there is isovolumetric contraction. Isovolume, that means there is no change in volume, but the ventricles are contracting. This is isovolumetric contraction. There is slight increase in pressure of right ventricle. Okay, slight increase in pressure that causes your tricuspid valve to bulge into the right atrium. Okay, you can see here the tricuspid valve is getting bulged into the right atrium during this period. Which period, friends? Isovolumetric contraction. So due to this tricuspid valve bulge, there is slight increase in right atrial pressure, and that is producing your wave called as C wave. This is your second positive waves. Think you have understood. I will revise later at the end of the topic. Okay, so you can see this is isovolumic contraction, wherein there is tricuspid valve bulge that is producing your C wave. So now after isovolumic contraction, that is after your C wave, the ventricles start contracting. Okay, ventricles will start contracting, and the blood that was there in the right ventricle gets emptied into your pulmonary artery and therefore into the lungs, and tricuspid valve will come back to its normal position, that produces your X descent. That because there is reduction in right atrial pressure as the blood is getting emptied into the pulmonary artery and therefore into the lungs, and then there is reduction in right atrial pressure that produces your X dash negative JVP wave. So friends, this is early right ventricular systole. That means now the right ventricle has started contracting. Okay, this is early right ventricular systole. What happens in late right ventricular systole is, you can see the right ventricle has pumped almost all the blood. Okay, almost all the blood it has pumped. Still there is some amount of blood that is remaining in right ventricle. So even that blood is getting emptied, and during this period, as you can see here, that right atria is getting filled up. Okay, right atria is getting filled up from the peripheral blood. Okay, the blood is coming from periphery to the right atrium. Okay, the right atria is also getting filled up, that causes your increase in right atrial pressure. Okay, this is your positive wave. Okay, positive wave. Which one? V wave. Okay, V wave. This is your third positive wave, that is due to rapid atrial filling. Okay, atria is getting filled up in the late ventricular systolic phase. Okay, so let's get into next wave. So as you can see, I told you in the earlier page that your atria was getting filled up with your blood, peripheral blood, and what happens in next phase is this atrial blood is getting emptied. Okay, this is initial phase of atrial systole, where there is passive moving of blood. Okay, there is no such an increase in right atrial pressure as to get this blood emptied into the right ventricle. There is no increase of pressure at all. There is reduction in pressure. So from right atrium, the blood is getting into the right ventricle. This is producing your Y wave. That is atrial emptying phase. This is your atrial emptying phase. So don't get confused with this phase with the first phase. Wait, I'll show that. This phase, don't get confused with this phase. You can see some amount of blood, initial blood that was there in the right atrium has already emptied. This is later stage of atrial systole. That means after certain amount of blood that gets emptied into the right ventricle, some amount of blood is left into the right atrium that needs effective right atrial contraction to push that blood into the right ventricle. Okay, so let me revise once again whatever I have told, because this is very important topic. Here you can see I'm concentrating mainly on your right atrium and right ventricle. So now that first thing happens is your atrial systole. Whatever some amount of blood that was left in the right atrium needs effective right atrial contraction that produces your positive A wave. Okay, after that blood that has gone out of right atrium, there is nothing left in the right atrium. Now atria has to relax, that produces your X wave, that is first negative wave. Now there is phase called isovolumetric contraction, because the atria has emptied all its blood into the right ventricle. So now now the ventricular contraction phase starts, which now you can see there isovolumetric contraction. Okay, that means ventricles are contracting against the closed valves. Okay, the volume is not changing, only the pressure is changing. And in this phase you can see there is a tricuspid valve bulge. Okay, so this causes your C wave. C wave means tricuspid valve bulge, remember this point. So now the ventricular systole proper starts. All the blood that was there in the ventricle will get emptied into the pulmonary artery, thus producing your negative wave, X dash wave. Now in the late ventricular systolic phase, even your atria are getting filled with the blood, that is producing your positive wave, that is your V wave. Okay, here you can see tricuspid valve is closed. Tricuspid valve is closed. Okay. Now again all that blood was there in the atria will get into the ventricle. Okay, that again produces your V wave. Thus I think you understood this topic well and enough. In the next videos I'll be telling you other important points about the JVP, so stay tuned with my channel and thank you.